All right, we're officially gavelled in, and I just want to say good afternoon, everybody. It means a lot that everyone is here for an important hearing and this discussion, and I just want to give a lot of gratitude to folks making time out of their schedule to be a part of this. I want to welcome our witnesses, many of whom journeyed really far to be a part of this subcommittee hearing, and I'm also particularly grateful to have Tom Cotton as my ranking member and the work that his staff and he has done to make this hearing successful. We face a stark reality today. Our national correctional system, I think it's fair to say, is in crisis. The Bureau of Prisons is undergoing a well-documented staffing shortage. With 21% of correctional positions vacant, BOP has imposed more and more mandatory overtime, forcing officers to work 10, 12, 15, and we heard earlier today, 18-hour shifts. This disrupts their lives, makes it harder for them to find childcare or simply just to be with their families. The BOP has also relied on staff augmentation, pulling case managers, teachers, psychologists away from their work to perform duties they aren't often fully trained for. Our state's prisons are also functioning with dangerously low levels of staff in a way that I think we'll elucidate today. Over the last few years, we've seen an increase in the population of incarcerated individuals, which has now led to overcrowding. Correctional officers and their staffs are really struggling with this. These are some extraordinarily dedicated law enforcement Americans, yet they are overworked and underpaid and struggling with the resultant mental health challenges. I was stunned to find out how undercompensated they were when I sat down with Ms. Brandy Moore-White. It just did not compute to me how little we're paying them. And this, I want to say, leads to chronic stress. It doesn't just dissipate once officers leave the facility, it really follows them home. Devastatingly, it is estimated that 156 active duty correctional officers take their own lives each year. That's 3 individuals a week. The nation's correctional infrastructure is also in despair and more susceptible to extreme heat and cold, flooding, and other weather events. In Texas, more than 2/3 of the Texas prisons have no air conditioning, even after 10 incarcerated individuals have died from heat-related illness in the month-long heat wave back in 2011. This crisis has a profound human toll. In Georgia, it took 5 days for correctional staff to discover an incarcerated person's decomposing body after their death. In Missouri, despite multiple complaints and requests to see a dentist, an incarcerated individual pulled out his own teeth because he never received adequate dental care. Earlier today, the Judiciary Committee held a hearing about the Inspector General's disturbing findings that staff shortages were a contributor to deaths of incarcerated people in the Bureau of Prisons, not to mention the challenges and hardships placed upon our correctional officers. Our prisons have a weighty mandate to promote public safety by maintaining a humane and secure correctional environment and preparing incarcerated individuals to re-enter society. Plainly, it is not possible to accomplish this mandate with an overworked workforce laboring in unsafe and even undignified conditions. Look, the ranking member and I have areas of agreement and areas of not, but one thing he and I feel fiercely about, I've heard him speak about it, is this importance of public safety. Safe neighborhoods, safe communities, a safe country. If you look at our founding documents, so much of them, the establishment of our government was about keeping people safe, about public safety. Well, there's a direct connection between what happens in our prisons and the safety of our community, because 95% roughly of the people who go into prison come back out. An estimated 65% of the people incarcerated in the United States have a substance abuse disorder, but instead of providing services, we see that they're not getting basic medical care, which again has a direct correlation to how they behave outside of prison as well. The proven way to lower recidivism rates is to ensure access to medical care, including mental health and substance use treatment, which empower individuals through programming to ensure that incarcerated individuals are able to be successful when they're released. We even know there's a connection between incarcerated individuals being connected to their children and their families and their recidivism rates. What we need is common sense, evidence-based policies that promote proven methods to lower recidivism rates and empower people to succeed. Our correctional officers are public safety officials. They are critical to the safety of our nation. They are law enforcement individuals. Yet to deny them the resources or support we give to other members of law enforcement, or to have them disproportionately underpaid relative to the work of other law enforcement individuals, is not just disrespect, it actually undermines their mission of public safety. This crisis is a public safety issue and it is a moral issue. If you want to see the character of a country, don't look in our places of business, our fields of science and education alone. Look within our prisons. The condition of our prisons says so much about the character of who we are as a country. The people that work there, the people incarcerated there, do their conditions, do their work environment, do the conditions of their incarceration reflect the highest standards of a nation of our greatness? We should be setting the global example of incarceration and remediation, repair, and restoration. I look forward to this productive conversation with this extraordinary panel. I'm grateful again for everybody being that. And with that, I turn it over to the ranking member of this subcommittee, my colleague from Arkansas, Senator Tom.